osteomyelitis. I never hear anybody talks about this, but if you break your bone outside there, infection in your bone could literally kill you, and it will be very easy to kill. Well, how do you prevent this? There's antibiotics, sure, but all the studies show that it's a mix of debridement, surgical debridement, good luck with that, and some antibiotic. Well, then maybe AG medication treatment would probably decrease the load and decrease your risk of osteomyelitis. Porviodine, the old style of treating this stuff, this is what they do in the developing country. This is why I'm saying we need to start looking at what they do over there to see how we can do things here, and then we can diagnose. For example, a lot of the studies for antibiotics, to switch for PO antibiotics for a lot of infections, they're going to be treated with IV antibiotics first, then switch to enteral. So there'll be parenteral is what we call IV, IM, and then enteral is what you take by mouth. So a lot of the people will be started 2 or 3 doses or even 1 dose of parenteral, but they go to a level and then it comes down, and then they switch to pills. There's about 7 pills that the only ones that if you give intravenous that they give them parenteral or enteral, they're the same level. There's about 7 of them. Well, then let's start a research from there. Like, for example, doxycycline, I rarely hear about it, but more and more I'm doing my research on that. That seems the one that is most appropriate. It covers a lot of the gamut of the stuff that we have, cover a lot of the infections, and it becomes almost like a one pill, one treatment. Meaning that I got somebody with that infection, I'm not quite sure, he's doing poorly, I give doxycycline. It seems like that would be a much better approach, better intelligent approach than going and buying herself 6 or 7 different antibiotics, playing mini doctors when most people don't have understanding of pure pharmacology, or the people that sells you those products don't teach you properly what's the difference between this. I get comments sometimes, people don't even understand what bioavailability is. Well, if you don't understand what bioavailability is, what are you doing with antibiotic at home? Because that's the basic of antibiotics. That's how it works. This is what it's so important to know. So if you don't understand that, whoever sold you the idea that antibiotics would work at home didn't sell you the proper stuff, didn't properly train you. It's like the people with suture. How come nobody knew about stapling? And then when you get stapling, hey, oh, that looks a little bit simple. Yeah, why not? Does that mean staple is much better than suture? We can have a debate about that, but at least we bring ideas, we bring stuff, we support them, and so that's why you'll see at the bottom tons of link. And if you really want to do your homework about antibiotic and have a real discussion, sure, read every link about this, and you'll see there's going to be some parentheses about things that I kind of bring up and stuff. But I brought a lot of articles because I want to have a conversation. If people say you're totally wrong and blah blah blah, but sure, bring it on. Please bring it on. I'm more than welcome to have a discussion, but please don't just bring, oh, he said that and he said this and here's that. No, let's bring some studies. Let's show some stuff, because there's a lot of people that provide themselves as expert out there, and self-reliance medicine expert cannot exist because we don't have a zombie apocalypse every week that made people expert. They can be knowledgeable, yes. Expert, no way. There's nobody out there with the self-reliance medicine expert. I'm not an expert, and anybody else that promote themselves as an expert of that, they're already, if they're saying this, crush them, because they're not expert. There's no expert about that, because most of the stuff that we do is based on data that we collect, that we think, you enter this information in your brain based on the knowledge that you have and the study that's been done and stuff, and here's my not expert opinion, but knowledgeable opinion about that. I think that would work. That's why those dressing, like for example, I recommend, like for example, a lot of people, they'll say, oh, AG, too expensive and stuff. It's the $30 little gel thing. And yet, they'll go and buy a $20 bottle of antibiotics that would do probably nothing for any infection that they would have on their skin. First, because they wouldn't have the proper absorption, and second, most antibiotics, you don't know. They could be MRSA or VRE resistant. They could be a whole bunch of resistance and stuff, so your antibiotic is not working. Every AG stuff kills virus, MRSA, VRE, Manuka, honey, same thing. So anything that has to do with skin, you don't know what it is, a special rush, you put stuff on there. If that's the treatment you want, because you don't have to identify. That's what I'm talking about. We need to find things that work without identification, because we have no tools. We cannot just take off the hospital and come back. Like, people always talk about sterility and not reusing some medications and stuff and using disposable. Having in a hospital 100,000 patients a year is quite a different thing than having a small community with 30 people. Because what they have 100,000, yes, it's more cost effective to have disposable, because that's the only way they can prevent disease, infections, cleaning and everything, and it would be too expensive to do. But the 30 people community, to have the same approach would be too expensive, and your first aid kit would be so enormous because of that. So there's when you think about a strategy, you have to think about it in the context. What do I have and why are they using this? It's not because they're using this, it works good, then therefore I have to use the same thing. That's not how it works. Again, any studies, when they do X, you have to represent exactly the same context, but you have to understand why they went with that context. So a big study about expiration was the army was trying to see how they can keep those medication, but they have the facility to keep them in a certain environment and everything. If you don't represent exactly whatever guidelines they had to do that study, that conclusion of that study do not apply to you. If you have medication in your kit that goes out sometime in the cold, sometime in the heat and stuff, boom, it nullified the conclusion. Whatever conclusion they did with that study doesn't work. If you find me another study that have studied the same thing in ambulance, where they go in and out, cold, hot and stuff, then yeah, now we can apply this, because it's the same thing applying. So this was a little bit of rant about that. Tons of again, ton of links, but what I really want is have a discussion, and you'll see through the video I show some pictures of things that could be. I think prevention would be the best way, because a lot of things, people buy those antibiotics, put them in the box, and that's it, I'm done. Well, what if they don't work? And there's tons of other stuff you can do to prevent the infection to happen. And if you can do that, or fight them in different ways, like for example, if you have the flu, antibiotic won't work, but if you use certain things like the spirometry, or if you clean your sinus, also controversy in that, but at least if you do some of that stuff, it could prevent you from having a sinus infection, to go from a viral infection to a pneumonia, a bacterial infection. And then if you don't, then you don't need the antibiotics. But then it works on your virals as well, so it's multi-use as well. So I think that conversation should have a two-tone. First, what should we really have in place? Everybody, the minimal kit, and really approach to prevent those infections. But then when you do have those infections, sure, maybe go and have something. But until we have this, there's no conversation. We cannot just apply this thing, and I wouldn't recommend anyone to go and buy those fish antibiotic for that, because we don't have enough conversation. We don't have enough information. Whatever is out there is not clear cut. There's not enough information out there to justify whatever they're saying, because I think it's misleading. A lot of the information out there is misleading. So let's have a conversation, and I'll talk to you soon.